afternoon, everyone, and thank you for joining us for another edition of Kidney Talks with the GW Ron and Joy Paul Kidney Center, MOTEP, the Minority Tissue and Transplant Education Program, the Pennsylvania Avenue Baptist Church, and of course, BlackDoctor.org. I'm your host today, Suna Halley. I'm a program manager at the GW Liver and Pancreas Institute for Quality. As you may or may not know, August is actually National Minority Donor Awareness Month. And as we are nearing the end, we have a special webinar planned for you today focused on the past and present of this awareness month and organ donation. Our panelists today are no strangers to the show. Dr. Clive Callender is a professor of surgery at Howard University College of Medicine and founder of MOTEP, which is actually the organization that started the original National Minority Awareness Week in 1996. And we have Mr. Kenny Boyd, the Vice President and Chief Business Development Officer for Infinite Legacy. Without further ado, Dr. Callender.
Thank you very much. It's a great privilege to be able to share the evolution of National Minority Donor Awareness Month. The next slide shows that I have no disclosures, and we're going to just describe the evolution of National Minority Organ Donation Month. Next slide points out that the number one problem in transplantation yesterday, today, tomorrow, and has always been the shortage of donors. We have about 100,000 people who are waiting for organs, but we only do 40,000 transplants a year. So that means 60,000 people are waiting for organs. And as a consequence, 17 people die every day because of this donor shortage. The next slide will show you that we started this work actually in 1982. The data represented that minorities were more than 50% of the national transplant waiting list, but only 15% of the donor population. At that time, they felt that Blacks were not likely to donate. And so it was a group that they were kind of leaving alone. The next slide points out that while it first was brought to me in 1978, the Southeastern Organ Procurement Foundation came to me to request my participation since I was the only African-American transplant surgeon. But as is often the case with us as minorities, they had no funds to support this effort. And so in 1980, I met with Dr. James Payton, an eminent psychologist, and reviewed the data and felt that this is something that was so important that we needed to do something about it because of our predilection to hypertension and diabetes. The next slide points out that we went on to obtain $500 from Howard University to survey 40 Washington, D.C. residents and identified, as a consequence, two critical items. First, we identified the 5 reasons Blacks are unwilling to donate. And secondly, as important as the first, we identified ways to overcome their reluctance to donate. The next slide identifies that there are obstacles to donation among African Americans, and we're going to tell you about 5 of them. But the next slide points out that we were armed with a $500 grant from Howard University. We then convened 40-person focus group session, and the group met in 2 hours, and they gave them $50 for each person who was willing to work with us. Now, what was interesting about this is that at the beginning of the session, only 2 of the 40 signed donor cards. And actually in that group was myself, a nurse, and donor and transplant recipient. And so we then, as a consequence of what we found, began a pilot study between the National Kidney Foundation capital area and Howard University. And the next slide points out the 5 obstacles that we identified. First, the lack of transplant awareness. The minority people of color in the minority community were not even aware that we had more high blood pressure and diabetes and obesity than any other ethnic group. and that we needed transplants more than anybody else because of this predilection to hypertension, diabetes, and obesity. The second obstacle, after making them aware, was to look at the religious myths and misperceptions. Concerns that isn't that great getting up morning when you go to the pearly gates. If you only have one kidney and one wing, you can't get in. Otherwise, if you don't have your eyes, you won't be able to see great grandmama in the hereafter, forgetting that it's going to be a new heaven and a new earth and a new body. This old body is not any good. So that when we looked at all of the religions, we found that 98% of the cases, most religions are agreeable that it is in giving that you receive. It is in pardoning that you're pardoned. It's in dying that you're born to eternal life. So it is the right and proper thing to do, to give organs in life and after death. So the next obstacle was the fear of premature death. The fear that if I go to the hospital and I'm ill near death, they may want to accelerate my death and make me an organ donor. In point of fact, we have done things, as Kenny will talk about later, to ensure that that never happens. And so this was another obstacle that we had to overcome. And then the next obstacle was one that we all know about, the Tuskegee incident, and the fact that people of color, regardless whether they're Latino, Hispanics, Asians, or whatever, have been used as guinea pigs. And this is something that people remember. And this trust is probably one of the commonest reasons why people are unwilling to become organ donors. So we have to overcome that as well. And then the next slide shows the final obstacle, which is racism, the fear and the concern that if I'm a person of color and I leave my organs, they're going to go to white people, and that racism will be operative. And as a consequence, though, we then recognized, next slide, that those were the 5 obstacles, but that with education, community education and empowerment, we were able to go across the United States, thanks to the Dow Chemical Company Take Initiatives funds, and take the message that we learned from the DC Organ Donor Program and its success. And because of the fact that there was a Gallup poll showed that there was a tripling of awareness after we gave our presentations, and tripling of people signing donor cards after we gave our presentations. In a group that people said would not donate, Blacks, we said we should take this matter and apply it to all ethnic groups. And next slide, please. And as a consequence, we took our vision of MOTEP, the National Minority Organ Tissue Transplant Education Program, to Congress of the United States, where Congressman Stokes, Secretary of Health Louis Sullivan, and Dr. John Ruffin worked with us. And as a consequence, between 1993 and 2010, we were able to receive $16 million to help us to develop MOTEP sites across the country and 15 sites across the United States of America. The next slide shows you the fact that our basic methodologies to perform community education and empowerment was very successful. And the next slide points out that our mission was to reduce, and is, to reduce the number and rate of ethnic minority Americans needing organ and tissue transplants, emphasizing not only are we need to increase the rate, but we need to increase the number of people who adopt healthy lifestyles, and as a consequence, do not need organ transplants in the first place. So we combine 2 in 1. Next slide points out that in July of 1996, we got a proclamation by the United States Senate, co-chaired by Bill Frist and Joe Modley, and the District of Columbia's mayor, as well as President William Clinton actually sent us a letter supporting it as well. As a consequence, the next slide points out that our mission was to, and our goal was to increase the number of minorities who donate, receive transplants and decrease the need for transplantation by the adoption of healthy lifestyle. This was the first time this was done. While minorities comprise 25% of the population because of our predilection to diabetes, hypertension, heart disease, and obesity, we make up more than 60% of those in need for transplant organs. And of the 70 to 22 people dying daily because of the shortage of donors. And so therefore, we need this more than any other ethnic group. Next slide, please. Points out that we started off with National Minority Donor Awareness Day, launched in Chicago, August 1st, 1996. Because of its success, AMAT, the Auxiliary for a Multicultural Awareness and Transplantation, and the organ procurement organizations felt that because of the success of the day, we should change it to a week. And this we did in 2012. As a consequence of the success of the week, the National Multicultural Action Group of Donate Life America changed it to a month. So as of August of 2020, we then had National Minority Donor Awareness Month. And as a consequence of these efforts, among all the other efforts that we did, the next slide points out that in 2010, Blacks were ranked above whites and other ethnic minority populations as the number one ethnic group of donors per million within the United States. And this is something that we think we're very proud of, something that nobody believed would ever happen. Neither did I, but that's a miracle that I think I'm proud of. Next slide points out that we appreciate the opportunity. I would like us now to show the Kadura video. This is a video that speaks for itself and shows the miracles that happen with transplantation.
14% of the U.S. population are African Americans. Regrettably, African Americans constitute 28% of the individuals waiting for a life-saving organ transplant. The National Minority Organ and Tissue Transplant Education Program was established to decrease the rate and number of ethnic minority Americans who require organ and tissue transplants by means of illness prevention and education. Today, MOTEP would like to highlight how simple it is to give someone a second chance at life.
Hey everyone, my name is Katora and I'm here to talk about organ and tissue donation. While organ donation is a sensitive topic, it's incredibly important to so many people around the world, including me. I received a new liver because mine wasn't working well. And because of my liver donor, I'm alive and happy and healthy today. Organ and tissue donors are heroes, people who give the gift of life while they're alive or at the time of their passing to help someone like me. At only 2 weeks old, I began showing signs of liver failure because of a disease. And instantly, my parents became deeply concerned with the outlook of my future health. Unfortunately, Black, Indigenous, and other people of color are at higher risk for organ failure. These disparities and lack of access to credible information cause unequal harm to our communities. In fact, not having general information on donation is one of the reasons why my family had no idea what the future would hold for me when my symptoms started. But they did everything in their power to improve my health and left the rest to medical professionals and the universe. At 13 months old, I had surgery that would change my life. I received a much-needed liver transplant. Because of that, I've been able to live a full life with my family and loved ones, and I had a normal childhood. I've traveled the world, and I'm pursuing all my dreams. I have laughed, loved, and lived, and I'm beyond grateful that I received that donation from a living donor, my own mother. She donated a portion of her liver so that I could have the life that I have. Sadly, this is not everyone's story. Some people wait years for the right donor and the right organ, but more people who register to be donors means more people have the chance of getting a life-saving transplant. And there are many more organs or tissues that can be donated than people realize. Together, we have a lot to give to those in need. By registering to be an organ donor, you have the opportunity to save lives of people like me. Offering them a second chance at life and leaving a miraculous legacy is something that we're all capable of. So learn more about it today.
That was a great video. Yeah.
At this point, Kenny can tell us about what they do at Infinite Legacy to help us get more donors.
Absolutely. Thank you, Dr. Callender. I have the pleasure of joining Dr. Callender today and Suna to talk about the important work of Infinite Legacy. Infinite Legacy is an organ procurement organization. We're one of 57 in the United States of America that are designated by the federal government to provide that vital link between people in our community who are waiting for a transplant and people who are willing to give that gift. And so we look at Keturah's story, and I think the thing that we should pull from that is she was lucky. She was one of the lucky ones. But the rest of our community is relying on the work that is going on to educate our population. With the more than 103,000 people waiting right now, that need continues to outpace the supply. And so while MOTEP has done a tremendous job of both trying to decrease the need, which is one way to manage the supply challenge, is decrease the need for transplant, and also encourage people to donate, there's more work to be done. And I'm looking at my notes here. I've had the pleasure of my entire 31 years in this field, being able to learn and watch and just live in the shadow of Dr. Callender and the passion that he has for this work. But I took some notes because there was a couple of things that are really important about what we do as an organ procurement organization and how we partner with community organizations to get the information out, to try to address some of the myths and misconceptions that are hindering people from making that choice on their driver's license. Because donation is an after-death process. And so often, if there's an absence of your known wishes, then we're talking to families probably at the worst possible time to meet a stranger. Education about organ tissue and eye donation allows people away from a crisis situation to process information, to have some of those myths and misconceptions answered. Dr. Callender mentioned, racism and an opportunity to help people understand that organs are matched from donors and recipients through computer matching. So it's race, gender, social, economically blind. That when someone makes a gift, we're inputting information into a computer and getting a list of compatible recipients. And that list doesn't give any preference except for medical urgency. We don't even get to pick and choose who we think is the best person on the list. The list is followed in order so that we are ensuring that we are managing a fair and equitable system. We talk about education. I think that it's also important to point out that our education is not just with adults, where you might see us at your community health fair or at the DMV, but one of the things that we've partnered with Dr. Callender, our universities, especially our HBCs and our organ procurement organization, is to increase information in our middle schools and our high schools so that there are more minority professionals entering the field. And that's really important for several reasons, not just on the transplant side, because we know that if there are more diversity in the transplant field, whether it's surgeons or administrators or nephrologists, hepatologists, that there'll be increased access for people who look like them. But it also helps validate donation and transplantation in the community. Dr. Callender choosing this as a career, me choosing this as a career, normalizes it in our communities and says, well, that we have an opportunity to directly confront misinformation and to correct some of the things that would hinder people from making a decision that could save someone's life. And I'm just going to end with this for a second before I turn it over to you to kind of lead us in questions. But I think that, I talked about Dr. Callender and I, as an organ procurement organization, we are focused on outreach, and that community outreach is something that we really invest in to meeting people in their communities, underserved communities where information needs to be provided, and not primarily on organ donation, but on health in general. And so at Infinite Legacy, when we are partnering with our community, we're bringing the whole community with us. So we're bringing screenings, and we're bringing COVID testing, and we're working with people who support providing our community with school supplies, and integrating ourselves into the community so that we are not viewed as opportunistic, right? This is a part of our community that, if we can be more effective on prevention, then we've done a great job. But by building that trust, we also provide opportunities to increase supply by letting people make a decision about donation without some of the distractions that Dr. Callender has spoke about.
Thank you so much, Kenny. The wealth of knowledge between you and Dr. Callender is just so inspiring. And I'm sitting here taking notes, but if I really tried, I'll be writing down all day. But one thing you mentioned about prevention, especially in the minority communities, that as much work as we're doing, we still see a lot of numbers where minority, Black and brown communities still see a high prevalence of high blood pressure and diabetes. So the one question I have for you, Dr. Callender, is how can we continue to share information and education that relates to early prevention and also kind of eliminating some of these health, diseases in our communities? What's really the first step to prevention?
Well, I think that over the decades, and I guess I've been doing this for 40 years now, it becomes clear that we must take every opportunity to meet them where they are. We talk often about how do you get people to change their minds, and one of the first things is, can you meet them face to face? And so we started off with a grassroots effort, and so I think that is probably the most effective. But in this day and age, the pandemic has forced us to do many things, and so we talk about programs like this. We talk about community screening efforts. We talk about going into any group that would allow us to come and meet them either face to face or by social media or by any means available to go and talk to them. Because as Kenny mentioned, the worst time to talk about this is when you have a loved one who's died. But if you've already talked about this before, if you've already signed a donor card, if you've already registered to be a donor, then this then is no longer an issue, because the rule requires now that the person who makes the designation is the person who counts. Whether your family likes it or not, if you have registered to be a donor, you will be a donor. And it's against the law to do otherwise. So I guess to answer your question, I take every opportunity to go to any kind of group that will welcome me. The church was the first group that I used. And the church, of course, is a place where people trust. And since distrust was the number one obstacle, we then went to the church, and the pastors and the people in the church have welcomed us with open arms, because many of them have the same issues that we're talking about. They have heart disease, they have hypertension, they have diabetes, they have kidney disease. And so,
and here's a little secret for maybe somebody is watching this and trying to learn how to get the information out to different communities. For as long as I've even been in the grassroots and public health space, churches are one of the pillars of a lot of minority communities. So if you're ever looking to just start to get the word out, start with churches, start with local community organizations, because they are really the tempo of the community. Um, you were saying
Also,
something, Kenny?
also
Oh,
radio programs, Radio
mhm,
One and the
mhm.
Latino Hispanic programs. So radio is also sometimes a forgotten way of communicating with people, not to speak of the social media, which is now taking over much of the
Yeah.
things. But it still
That's
is
a
not as great as that face-to-face effort. Kenny, you were.
No, nothing beats. Yes, Kenny, go
no.
for it.
I was going to amplify something you said, Dr. Calendar, and it's quite embarrassing that Dr. Calendar, who is my senior, is probably a little bit better at social media than me. But I would challenge anyone watching. I think we're very good at sharing viral moments when someone falls or someone does something embarrassing. I challenge
Mhm.
people that when there's a story about organ tissue donation, a story about prevention, a story about transplantation, let's treat that as something share worthy also, because it is powerful. And especially as we look to connect to our young people who really do play an important part in normalizing this even more than it's been normalized now.
Absolutely.
The other
There's a
thing.
great question in the audience, Kenny and Dr. Calendar, if you don't mind me asking. This question is coming from Shalonda, and she asks, "What type of organ donation can a person give if they are not the most healthiest, or do these people, or can they not donate? So I'm not in the best health, but I want to donate. What can I do?"
I love that question. I'm sure Dr. Calendar will add to this as a transplant surgeon. But as an organ procurement organization, we have two missions, right? We want to provide every family possible the opportunity to honor their loved one, to allow that person to be a hero. And so we're going to evaluate each case on an independent basis. And although you might not feel or be the most healthiest, there's someone whose organs have completely failed. And
Yes.
so we're going to evaluate each potential donor on an individual basis. Our oldest organ donor in the country was 86 years old so far, who was able to provide life to another. And so I think that the victory is in just choosing to be a donor. And when you can't be an organ donor, there's still opportunities to contribute to this through tissue donation or research. Both further the field and they set an example of giving.
And
Uh,
just to add to that, the only absolute contraindications to donation are if you have active cancer or if you have an active infection. Outside of that, as Kenny has mentioned, you should be individually evaluated, because what you think may stop you from being a donor may not be the case. Because, for example, as he mentioned, age of itself is not a contraindication to donation. And of course, there are two types of donation. There's living donation as well as deceased donation. And one of the things that we recognize now that certainly deceased organ donation is the commonest donation, but living donation is also associated with the best results. And it is such a benefit to those who give. Some people actually believe they have two kidneys because one is to be given to someone else and the other is for themselves. The thing that Kenny talked about as it relates to eye and tissue donation. So many young people now who have accidents and have surgery now recover rapidly because they have tissues transplanted. Then, of course, the corneal transplants that help the blind to see, the lame to walk, and the deaf to hear. So that there's so many ways in which, for example, when you talk about tissue donation, you can help maybe 80 people. Of course, with organs, you can save the lives of 8 people. So these are ways in which we can help one another.
And I wanted to just amplify one thing you said, Dr. Calendar, is that you should get evaluated. So whether you're on the side of wanting to donate or on the side of wanting to receive donation, sometimes in the community I hear that individuals say, "Oh, I know, I read online," or nothing beats the advice from a doctor. So going to a doctor and being evaluated and letting them say you can or cannot be a donor, that's the only absolute way to know if you can be a donor or would be a good recipient also. Um, we're going to go back to the comments as well. We have a comment there from someone about donating. This is from Marlene. She says, "We, her sisters, and I honored my brother's wishes to donate his organs. He died from complications of CVD after a massive stroke. After evaluation, his corneas were donated." Wow.
What an awesome
Wow.
testament. Yeah, your brother is a hero. And I think that on behalf of the recipients and the whole donation community, I thank your family for honoring his wish and making that very important decision to provide help and healing to others.
Wow. What a remarkable story. Thank you for sharing. So I have a question. Maybe somebody in the audience is thinking this also. You're welcome, Shalonda. She says, thank you for answering her question. What type of donations, if Dr. Calendar, living donation can be done? I know that we could do kidney. And then what type of donations can be done as deceased donors?
Well, as deceased, well, as living donors, of course. Now that we can actually do living liver donation as well as
Mm-hmm.
kidney donation, and I think that there are those who think that those are the main organs. Of course, you can do lung in some circumstances, and intestines in some circumstances. So those are the ones that you can do living, as well as the kidney. Now, for a deceased, then of course there's 8 organs that can be used: 2 kidneys, the liver, 2 parts of the liver, 2 liver donors can be, and then you have the heart, and then you have the lungs, and then of course the pancreas and the intestine. So that there's so many ways that you can help others. Love is what it's all about, and caring for others, giving the gift of life. What an opportunity, whether it's in life or after death. It's one of the things that is very important is to recognize that when we speak of religion, we're talking about going to have a new heaven, a new earth, and a new body. This body is of no use after you die, unless you actually have it used for organ transplantation or for research or for other reasons. But I think it's important to recognize that.
And I was just looking at the bottom of my screen and I see Marlene's comment. I want to thank her for putting that up there. I think that it's very easy for people to think that when we work with families who choose donation, that is very transactional. And I love that
Mm-hmm.
she pointed out our aftercare. At Infinite Legacy, we have a very robust aftercare program for our families, whether it's supporting them through grief counseling and events throughout the year, to engaging them as volunteers, allowing them to be ambassadors and to share their
Yeah.
stories. And so that's really important for people to understand that it really is just a really big and important part of end of life care, is ensuring that people have this opportunity. And sometimes even if families say no, it was the first decision that they had an opportunity to make. And I'm going to just stay here for a moment because I grew up in healthcare. And so often we are in situations where someone suffers an acute situation, acute injury, and they arrive at the hospital well before their family or their loved ones. And by the time they get there, sometimes the doctors are giving grave news or grave prognosis. And when we love people, we want to take care of them. We want to protect them.
Oh yeah.
When we're in healthcare scenarios, that control is taken away. And sometimes the only opportunity that family has to make a decision is at an end of life decision with donation. And it's so important to empower them in a situation where they've had no control up until that moment, even if they choose not to.
So thank you so much for sharing, because the only way to be educated about it is to be educated. And I say this during every webinar: the information that you hear here on this webinar, please share it with someone, share it within your community about what the process looks like. Marlene even shared in the comments that it was 2 years. So you're not left alone and left out to be, figure everything out by yourself. It's a community. And even in the world of outreach and where I do a lot of my work, when we see individuals who have either been family members of a donor or a recipient, they always want to come out into the community and talk about the experience, because there are so many misconceptions before they went through the process that they're just absolutely blown away. They want to share it. So that's one of the biggest reasons why we do these webinars, to share information so that you can take them back to your respective communities. Kenny, I want to ask you a question, because I've seen you do this in person and it took less than 5 minutes. How does one sign up to become an organ donor? Yes, you can sign up at the DMV, but what's another way that you can actually sign up to be an organ donor if they want to do it after watching this webinar?
You can go to beadonor.org. You can do it at your DMV, like you mentioned. There's a national registry also. And it's just ran out of my mind. I'm sorry for that website. But all of the links, infinitelegacy.org has a link. MOTEP has a link for you to be a donor. But beadonor.org will have all the links for you to be a donor.
Perfect. Thank you so much. That's very important. I also, from Dr. Calendar's presentation, you mentioned that MOTEP, of course, has a mission to educate about minority donation, but to also reduce the need for organ donation. So what does that look like on the outreach side, and how has that kind of progressed over the years since you started MOTEP?
It's interesting that you would ask that question, because our first MOTEP grant was entitled Prevent the Need, because what we did that was special was not only did we try to increase the number of organs donated, but we also tried to get people to adopt healthy lifestyles, to get them to decrease the amount of red meat they eat more vegetables, fruits and vegetables, and more fish, to get them to exercise, exercise at least 30 minutes a day, 5 days a week, to meditate, to address the high amount of stress that we as people of color encounter. Stress is a killer, and meditation along with exercise and diet help you survive. And so through the years, we also recognize that the person or the people who make the greatest impact are people who are donors, people who are recipients. These people, when they tell their stories, people listen, like Kadura in the video that you saw. People listen to them because they make a difference. People who are waiting, who need this, so that in the community we emphasize preventing the need and adopting healthy lifestyles, because we want to decrease the number of people. People of color have the highest incidence of end-stage renal disease, the highest incidence of hypertension, obesity, heart disease, and as a consequence, our emphasis over the decades has increasingly been to prevent the need in the first place.
Yeah. All this history, I'm going to remember this webinar for a long time, because it's what we're doing in it. A lot of individuals, especially healthcare systems, they model their outreach and education off of MOTEP and the work that you have done. So to hear kind of the source of how it all got started, it can implore somebody else to kind of do the same programming, and you can also achieve a mission. It just starts with the charge. So I love to hear it. We talked a lot about how to become a donor. We've talked a lot about just the different illnesses that plague our community. Dr. Calendar, when you started Minority Organ Donation Awareness Month or week, and now it's a month, what is the one charge you want everybody to do going away from this webinar? What do you want to make sure that they don't forget and implore from here on out?
One of the things that I think is important is to recognize that we are one race, Homo sapiens. Whether we're people of color or not, we should remember that leaving organs and tissues after death and in life is all about the love that we need to share. And whether you're a minority or not a minority, I think it's critical to understand that it isn't giving that you receive. And so donating is an act of love. And what has been so impressive to me is, particularly for living donors, is the benefit that they've gotten from giving. And sometimes we think that receiving is important, but actually it's the giving and the love that is manifest that makes you a better person. So that I think that what I'd like to get across is that it's all about love. It's all about giving, and it's all about caring. And so we have a responsibility to give as well as to help others. Education is power. Information is power. And so our goal is to educate and empower as many as possible. I've found throughout my years of experience that the most efficient and effective change agent is actually the community. And so going into the community, educating them and empowering them is what makes a great difference.
Absolutely. And Kenny, before I come to you to just give your charge, we have one more question from the audience that I'd like to get us to answer. This again is from Shalonda, and she says, do you encourage families and recipients to make contact?
So, the Organ Procurement Organization is the middleman, and when it comes to deceased donation, right? A living donation, you would more than likely know your donor, but in deceased donation, where your gift came from a stranger, someone who died, it's not a condition of being listed, and it's not a condition of being a donor. But we do act as the middle communicator, and so a lot of times that communication starts with a letter from a recipient without any identifying information, or we'll take out the names for them and any identifying information and allow donors and recipient to pass that information between. And then sometimes that does grow to situations where donors and recipients meet, and it's one of the most powerful moments. So if you ask me if I encourage it, I'm neutral on it. I think that there are some recipients who might not be ready to meet their donor families, and it's not because they don't appreciate the gift. It's that sometimes they begin to understand that someone had to die for them to live, and they might not be ready for that at that moment.
Yeah. Absolutely. I wasn't going to share this, but I recently went to a dialysis center to get out information about transplantation, and someone, as we're walking in, said, "Oh no, you're the reaper of death," or something along those lines. And he further explained that sometimes it's a happy but sad thing, because in order to give life, somebody would have had to die. So a lot of perception is dark around transplantation, but we see stories on the other side of providing light and life, and individuals like the story that was in the video today of Young. She didn't have a lot of times associated with livers, maybe substance or a different type of abuses, but she was born with a liver condition, and didn't have a chance, and somebody was able to provide her with life. So it's also about changing our mentality around it. It'll be a great thing.
And can we
So
turn
Kenny,
into that storm for a moment before I give you my charge? Can we just turn into
yeah,
that storm? I think a lot of times people want to look at donation in the way that you just explained it. But what I challenge our audience and for anyone who's faced with this question is to understand is that we didn't plan that event.
right.
What brought someone to that situation?
Hmm.
If you asked me what was the most potent moment that I've observed in my career, I would tell you that when I saw a mother whose child had died, who was a heart donor, and she went to the recipient of that heart donor and listened to her son's heart beat.
Oh, whew.
To me, that was the most emotionally gratifying period of my life and career, because I think that's what it's all about. The
Wow.
fact that your loved ones live and have a second chance at life in someone else. And that's what makes a big difference.
Makes a very huge difference. I mean, and it's beyond words. It's something that I couldn't even imagine. Just you saying that gave me chills, Dr. Calendar. I couldn't imagine. But what a gift. What an amazing gift to give. So for anybody watching, we've given you a lot of information. We've given you some clinical, some outreach, some prevention, and we've given you a humane reason, and to as to why donation is important. So please take this information, share it within your communities. Um, the next time you hear about donation, you'll be able to speak to it, and come back to blackdoctor.org and see all the information here. Kidney Talks, we've done a wide range of talks about donation, almost every aspect of it, where you can really learn about the impacts that transplant donation makes. Our last webinar, for example, we had recipients and their donors on this very platform talking about kidney donation and kidney, transplantation, and just how much of an impact it made. And you, we hear stories all the time. So please continue to come to blackdoctor.org and connect with our organizations, MOTEP, Infinite Legacy, the GW Transplant Institute, because we are definitely at the forefront of the advocacy and outreach when it comes to transplantation. So thank you so much for attending our webinar today, Dr. Calendar. Thank you so much for the information that you imparted on us. And thank you to Kenny for his work in the community for well over so many years, and always being willing to get out there into the community and help us understand exactly what donation means. Thank you, Felicia, for letting us know we did a good job today, and thank you for being a part of our show. And as we close, we just want to say again, happy National Minority Donor Awareness Month. Please take the information that we talked about today and share within your communities. So on behalf of the Kidney Talks with the Ron and Joy Paul Kidney Center, MOTEP, the Minority Tissue and Transplant Education Program, the Pennsylvania Avenue Baptist Church, blackdoctor.org, and Infinite Legacy, we want to thank you for joining Kidney Talks. Our next installment will be on September 8th, same time, 2 p.m. here on blackdoctor.org. Have an amazing day.